It is just a huge honor today to be podcast interviewing my buddy for 30 years, Dr. Jeffrey Hoos. He opened his private practice in 1979 with one dental chair and a baby that came 1 week later. Today, 38 years later, the Brush Floss Dental Center has 4 partners and a staff of 25. The office is open 6 days a week and 4 evenings a week. The mission statement of the office: provide the highest quality care for the greatest number of patients and at the same time maintaining a balance between personal and professional lives. Dr. Jeffrey Hoos has an educational goal of provide dental education for professionals that will enhance their professional lives, provide information that will allow them to provide a higher quality care for their patients, balancing the art, science, and business of dentistry. And I want to tell you from a personal note that you have always been a legend to so many people like myself, especially boomers my age, when everybody was having such a hard time taking impressions like 30 years ago. I remember for me personally, what you did for me personally, and a lot of my friends with Woody Oakes and the Profitable Dentists and all those guys, and Joe Stevens, who just passed away. You came out with an impression technique that I just like hit my head on the forehead like, damn, why didn't I think of that? That was a great impression. But I've been learning tips from you. I mean, I'm 55, you're 65. You were 10 years out of the gate. No, you came out in 79. I came out in 87. But anyway, long story short, you helped me and so many people on who subscribed to the Profitable Dentist back in the day with Woody Oakes and Travis McPhee. And thank you so much for all that you did for my career. So how are you doing today?
I'm just doing awesome. I'm sitting here in my library looking out at the water and spending time with you, Howard. I remember so many of our times together with Joe, may he rest in peace, and trying to make it all happen. And, you know, kudos to you, baby, because you made it happen, and I am thrilled with the accolades. But I got to tell you, Howard, what you've done for the dental community and putting it out there and telling the truth, you deserve much more praise than I ever should. And our friendship is, though we don't see each other for dinner, our friendship goes back a long way. And I remember that time I came to the office in Phoenix, and you had that young guy, you know, in the office, you know, scared to death to have an impression taken. And you said, I'm going to take care of this right now. And that was the whole start of everything. So, and promoting that technique, I really appreciate it.
And thanks for that. But the neatest thing about Joe Stevens is my little brother was born when I was a senior in high school, so he's 17 years younger, and he went all the way through Bishop Carroll High School with Joe Stevens' daughter Jasmine, who now took over her father's practice, and it's just so romantic to see the passing of the torch. So let's go to the very beginning. How did a guy like you, who I feel could have done anything, you could have been just as successful in restaurants, business. I mean, I could see you doing anything. How the heck did you end up in dentistry?
Oh, the story is really quite remarkable, and I actually talk a lot about this in my lectures. The truth is that when I was 4 years old, I had never been taken to a dentist. My mother was what was called a Bangor bride. And for those of you who know what a Bangor bride is, I grew up in Old Town, Maine. A Bangor bride was someone whose teeth were removed because as a bride, she was presented with no problems in her mouth because she had dentures. And I wasn't taken to a dentist until I was 4 years old when I had a horrendous toothache, just a horrendous toothache. And of course, the dentist was appropriately named Dr. Savage. And when I had my tooth removed and I was blood all over me, I basically decided that I was never going to the dentist again. And what happened basically, I was a pretty smart little boy, so when I would be taken to the dentist, I would do things like go to the bathroom in my pants. And my mother, being a smart lady and a school teacher, she'd being a fresh, clean pair of clothes. And then I'd take it up to the next level, and I decided that I would spontaneously throw up. So imagine being so frightened that you could spontaneously throw up. And so one Sunday morning, I had a horrendous toothache, and my father we were at a synagogue breakfast, and I had lots of lox and bagels in my stomach. And my father called I was taken to his office, so the first thing I did was I went to the bathroom in my pants. And my father, being the way he was, he took my pants off and he wrapped some newspaper around me and said, okay, we're going in the office. So then I proceeded to go in his bathroom and I threw up all over the floor. And Irving Paul came into the bathroom. He sat down on the floor and he said, I understand how you feel, but if you let me help you, I will take care of your toothache. And I bonded with him. And so my mother had a cut and paste when I was 5 years old. I want to be a dentist. And so I've wanted to be a dentist my whole life. I am probably the most self-actualized person you've ever met in your whole life. And when I applied to dental school in 1974, all the guys were coming back from Vietnam, applying to dental school. And where I went to dental school at Tufts, there were, I think, 4,000 applicants for 150 spaces. And the competition was huge. But because of my wife, she would not let me be deterred. And so I ended up having to go back and get my master's in biology, and I went to dental school, and no one was ever happier being in dental school than Jeffrey Hoos. And that's how it all started, from a negative experience to a positive experience. And there you have it.
So you said your mom was a Bangalore bride? She's from India?
Bangor, Maine, a Bangor bride.
Oh, Bangor. Okay.
Bangor, Maine. And so what happened was women's teeth were taken out of their mouths so that they didn't have any dental needs.
So, Jeffrey, how did you decide to start your own dental practice as opposed to being an associate?
Oh, I have to tell you, I tried to be an associate. I was an associate for 6 months, and and I got fired after 6 months. And so what's so interesting is when I had a year contract with the gentleman, and it was about Christmas, and I thought I was being very honorable, and I said to him, listen, after my year contract, I don't want to continue with you. I'm going to go out and do something else. He goes, that's okay, because I don't want you to continue anymore. So there I was, 6 months, and without a job. And I called my father on the phone, and he said, it must be bad. I said, why do you think it's bad? He goes, why would you call me at 7 o'clock in the morning? So I said to him, well, listen, I lost my job. He said, well, that's okay. Go find another one. So I went and found another job, and as an associate, and the guy basically was doing some very bizarre stuff, and I was losing my mind. So then I found another job. I was only there for 6 weeks. And then the third job I had, there was just some other crazy stuff going on. And I came home one night, and one of my friends was there who was an older oral surgeon. My wife had called and said, I'm worried about Jeffrey. He's acting crazy. And so his name is Dr. Earl Slusky. He was an oral surgeon. And he said, you need to open your own practice. You have too much to offer. I said, I don't have any money. He goes, I will go to the bank and co-sign the note with you. I said, you'll co-sign the note with me? He goes, you are a talent. He said, and therefore, I want to be part of your success. So it gave me the power. It gave me the impetus to realize I could do it. I borrowed $40,000, and my wife, who was then 6 months pregnant, we proceeded to open a dental office on the second floor of a bank building, a second floor walk-up. And 1 week after I opened my practice, Michelle Hoos was delivered. And the morning my wife's water broke, I turned to her and I said, does that mean you're not coming to the office? But that's how it all started. It started out of necessity.
How old is your daughter today?
She is 38 years old.
So, we're boomers. And when I got out of school, May 11th, and today is September 15th, and next Thursday is my 30-year anniversary, and we're having a big open house and everything for my 30-year anniversary. So it took me not even 4 months to open up my own practice. You did it in 6 months. Today, a lot of people that are boomers think that the millennials are different, that they just want to be employees. Now the demographics change. Half the class is women. If you look at the 35 largest corporate dental chains in America, like Heartland and Pacific and Aspen, 2/3 of all their associates are women. Do you think that it's going to be different going forward? Do you think guys like you and me who got out of school, wanted to do it our way, wasn't good at taking orders, wanted to control the outcome, we hustled, all that stuff. Do you think it's different today, or do you think or not?
I think we have to not generalize, but I've read all of the same stuff that you've read. The millennials, they look at jobs, having 5 jobs in 5 years, I get it. It's okay. The concept of loyalty to the Sikorsky aircraft and live and die by Sikorsky or GE or any of the corporations, I think that's done. I also think, though, that when people are given the right opportunity, they do want to be owners and they do want to be committed to, I'm going to use the term excellence. I am not suggesting for a moment that the people in Aspen or Heartland or Coastal or any of those don't want to do excellence. But what happens is they're so saddled with debt that they get driven into a situation where they're required to get a job. And when you have companies that are willing to give signing bonuses and help them relieve their debt, they seem to be enticed. So I'm going to backtrack and say that though it has changed, people still have an entrepreneurial spirit. They still have an opportunity. They still have an entrepreneurial spirit, but they have to be shown that it will work for them, and that they have to have a little bit of an attitude shift.
Another thing you're legendary at is you were named Hyason's Connecticut Clinical Director of Education. First of all, congratulations on that. But you're talking to a lot of millennials right now, and we just had 6,000 American children graduate from dental school 3 months ago. Another 6,000 just started their new freshman year D1 a few weeks ago. But the graduates all say, Jeff, we didn't place one single implant in dental school. Being the clinical director of Hyason's implant deal, what would you say? How does she go from I've never placed any to placing one? And how do you go there? I mean,
okay, so you could ask a better question in a sense. Not that any question you ask how it's not perfect. Let's ask them how many dentures they've done, or how many crowns they've done, or how many occlusal adjustments they've done, or how many TMD patients they've treated. My advice to any millennial is you have to pick one thing and gain excellence in that one thing. So let's take something simple like dentures. More dentures are going to be made in the United States of America next year than the previous year. People are living longer. So therefore, if you can say, I've done one denture, or I've only done a denture on a model, then you have to take it upon yourself to find the course that's out there that will teach you and help you learn how to make great dentures, and practice it and work at it. And then when you have captured that knowledge and you feel confident that Mrs. Smith, who has a difficult denture case, that you can manage it, and you've made a decision to learn what a Gothic arch tracer is, made a decision to understand about flat plane occlusions, understand what monocentric occlusion means, understand what aesthetic phonetics are in dentures, and become excellent at it, then you move on to the next step. You don't learn how to ski by going up to the double black diamonds. So when you want to pick something like implantology, I would say to you, how many teeth have you extracted? Do you feel comfortable during surgical procedures? No, I don't. Therefore, you have to take some great exodontia courses. There are a ton out there. You have to invest in yourself. You have to feel comfortable doing surgery and then go to the next level. I've placed over 4,000 implants as a general dentist. I started out placing implants? No, I did not. I took multiple courses, invested in myself, and then had to make it happen. I actually hired a guy to come to my office to be with me when I placed my first implants. By the second case, I said, you can go home now. Because Ken Judy said, if you can take out a tooth correctly, you can place a dental implant. Also, the technology now is better than ever. You have cone beams, you have guided surgery, but you have to put your investment in yourself to get the right education. And also, don't go all over the map taking multiple courses. Learn a system, learn it well, proceed forward, and then branch out. So if you can get exodontia and you really understand how to take out a tooth painlessly and understand how to have zero post-operative pain other than some generalized soreness, you understand how to do simple bone grafting, then you're ready to take the next step. You don't learn how to make a whole sweater without learning how to knit and purl first. Slowly, distinctly.
So how's Ken doing these days, Ken Judy?
You know, I haven't seen Ken in a while. I have a feeling that he's a little bit older than I am, but he's contributed so much to implant dentistry, as did Carl Misch, may he rest in peace, that the whole concept of learning slowly. But I'll always remember the quote, if you can take out a tooth, that very invasive procedure, you can learn to place a dental implant. I'm not talking about learning bilateral sinus lifts or nerve repositioning. I'm talking about simple, and there is such a thing as simple implantology. If Joe Stephen can learn to place an implant, then we all can learn to place an implant. Direct quote from Joe Stephen.
So who were your implant mentors? Ken Judy? Carl Misch?
I basically started training with a guy named Harold Bergman, who actually developed an implant system called the Anchor implant, no longer available. And then I actually trained with Paul Schnippman, who was one of the first guys to bring implants to the United States. I took a 10-month weekend course with Paul Schnippman. I invested $14,000 in that course. Joel Rosenlick in Connecticut, and reading magazines, listening to different people. And there are great people. Mike Picos is out there in bone grafting. There's tons of people. There's so much to learn, and so you get to a certain comfort level. As many implants as I've done, if someone comes into my office and they need a nerve repositioning, I'm not doing that case. There are enough, quote-unquote, easier implants to do.
You're up on the East Coast. Did you ever learn from Leonard Linkow, who passed away this year?
I took a course from him many years ago. And Sendex, mini implants. But we've all moved on beyond that. You know, we've moved beyond those things.
Man, we lost a lot of legendary people in implantology lately. I mean, Dr. Leonard Linkow in 2017, Carl Misch, Brandmark the year before. It's been a lot of passing of the torches in the last year or so.
Guess what? We're next.
Actually, you might not know this, but I'm going to be the first person who never dies. Did I tell you?
I've taken a number of courses that were interesting about, my wife and kids laugh at me. I have more self-development books in my nightstand than I do, anything else. And I learn from a lot of different people. And someone says you need to project that you're going to live to 125. And the answer is because you have a much more positive attitude. And speaking of millennials, I have to say that one of my goals in my courses and people I talk to is I am tired of talking to dentists who are down in the mouth about dentistry. I have to tell you, we are in the best profession in the world. I go to my office and what do? I do arts and crafts all day long. I give people back their smiles. I take them out of pain. I'm enthusiastic. I'm more enthusiastic about dentistry than I ever was before. If you think about in 1978 when I graduated and someone broke off an incisal edge of their tooth, what were you supposed to do for that? Put a couple of pins in it or a rhodium piece of wire? Because if you put acid on dentin, you knew you were going to kill the tooth. I mean, this is the thing. The millennials need to understand they're in the golden age of technology and dental materials. It is so much easier to do dentistry now.
Is it the golden age or the titanium age? Because I have 7 gold inlays and onlays on my teeth, and I think gold is dead. And now I see all this titanium.
Well, you mean titanium in terms of implants or titanium in terms of in teeth? No
Implants.
One's putting
implants.
The answer is that I would say the day of the 3-unit bridge is over. You know, tooth number 19 is missing, 18 is a virgin tooth, 20 is a virgin tooth. I think that it is absolutely incorrect to mutilate 2 virgin teeth and put a 3-unit bridge in. And patients are now asking about dental implants. We are in the age of implantology. But remember, conventional dentistry is not dead. I'm a little concerned about new materials. You know, everyone's going to solid zirconia crowns and they're going to layered zirconia. I think we need to be careful about jumping on new technology too soon. I talk about how many people have done art glass fused to metal bridges. You know,
Reyes Colzer, thank you.
I have 120% failure rate in those. Why? Because I was stupid enough to do them over again in art glass fused to metal. Now, art glass was a fabulous material if you bonded it directly to the tooth structure, but it wasn't a fabulous material if you bonded it or you put it on metal. And so the point is that we many times get sucked into by manufacturers to try things in our offices. Targus Vectrus bridges.
Thank you, Ivaclar.
Yeah, I mean, so here's another interesting thing. Maryland bridges, do they work or do they not work? Do Maryland bridges work or not work?
I put a lot of them back in the 80s with Panavia cement.
Right. So the answer is Maryland bridges work, but what really works, if you had to replace a lateral, what really works is if you do a unilever Maryland bridge, hang it only off the canine so that you unilaterally just have that supported. Someone says, well, you're losing support. How many were debonded off of just one abutment all the time? Right. It's because when the patient goes into lateral excursion off the canine, it torques the Maryland bridge. So Ray Bertolotti has demonstrated hundreds of these, and the right technique in terms of the preparation, unilateral Maryland bridges work great in the right situation. And it goes back to the concept of the millennials, and I don't want to get into the occlusion wars. I mean, we all had those. You have to understand how occlusion works and how it does not work, and understand how that fits into your daily dental practice. Those people who are suffering from broken fillings and broken teeth, we're seeing more cracked teeth in our practice than ever before. I don't know if it's the stress of the year 2000s, but more cracked teeth than ever before. And why are they cracked on the distal of number 18 almost exclusively? Is because there's a discrepancy between centric relation and sectron occlusion. And do you do a full arch splinter? Do you do an NTI, or do you use a leaf gauge? These are all things that need to be spoken about.
So you're a very smart guy. Why I mean, there's over 400 dental implant companies. Why did you go with Hyacin?
Well, it's interesting. I don't just place Hyacin implants. I also place an implant by a company called AB Dental, which is an implant company from Israel. So I will tell you how I chose my implant company. The weak link in implantology is not the implant. The weak link in implantology is the connection between the implant and the abutment. And there's a very famous study that very few people are talking about the micro movement of implant abutments causing screws to be loosening. But more importantly, you see a micro pump of bacteria. And when you see inflammation around what I call the transmucosal abutment, that is not whether the implant is crestal, subcrestal, bowl of bone. It has to do with the micro pumping of the movement of the abutment. So there are only a few companies that do not demonstrate movement of the abutment. One of them is AB, one of them is Hyacin, one of them is Ankylose, and interestingly enough, Bicon doesn't show it either. And so we need to understand the mechanics of implantology, not just implant placement. Scott Gans talks about.
Well, what was the fourth implant company you said?
Bicon.
That's in Boston, right?
Right. So Bicon. But Bicon has an interesting connection. It's a friction connection, and some people don't feel comfortable using that. But what's interesting is that Scott Gann talked about crown down. I talk about thinking about restorations before you think about implants. What is bizarre to me is patients show up with dentures in my office and they say, "Can you put some implants in?" And I said, "I can, but we need to make you a much better set of dentures before we can do that." We need to understand where we're going before we're getting there. You know, Stephen Covey, think with the end in mind. So when we think with the end in mind, you have to visualize the end game before you start talking about implants.
So what is your go-to implant for when I look at a spread of 100 million insurance claims, it's pretty much a flat line with 4 huge peaks on the 6-year molars. And those are teeth most likely have fillings, crowns, root canals, extractions, implants. So just for the standard routine, you talked about 3 and bridges are dead. For your standard molar, what's your standard molar go-to implant?
I use a company called AB.
AB.
AB implants.
So that's your go-to, not Hyacin or Ankylose or Bicon. What do you? Go ahead.
Well, I'm going to say, so I chose, and again, in truth in disclosure, I lecture for AB, and I will tell you, I was trained with Noble Biocare, which was the Brandemark implant. That's how I was trained, straight wall external hex. And we actually became the first general dental office to be a Nobel Biocare mentoring office. And as a general dentist, when I took my training, it was almost unheard of a general dentist becoming trained to place implants. You could only be a periodontist or an oral surgeon. And so when I actually became a Nobel trainer and I lectured for Nobel, the people in my surrounding towns turned around and said to Nobel, "If you continue letting Dr. Hoos train general dentists to place implants, we will no longer buy from you." The periodontists, a few periodontists got together and an oral surgeon got together. Very nice, very nice. So I said, okay, that's fine. And then what happened was some guys broke off from Nobel and they started another implant company. And thanks to people like Carl Misch and Paul Schnittman and Ken Judy and the ICOI, they basically said, wait a second. The first implants were placed by general dentists, Lenny Linkow and all of those guys. And so it's a general dentist technique. And so thousands and thousands and thousands and thousands of teeth are taken out by general dentists. But if you want to tackle a distal angle impaction as a general dentist, I suggest you need some superior training. That's where your specialists get involved. And I will say, when Earl Slusky called me on the phone one day and said, I want you to come to my office and learn how to do an apico. I said, what are you talking about? He said, I don't want to see apicos from your office. I want you to send me your distal angle impactions. I want to train you how to do an apico. And I saw one, did one, watch one, assist one, do one. And I do apicos routinely in my office, or did them routinely. Now we're doing fewer apicos because those teeth are being sacrificed and implants are being placed. But you have to be comfortable in your own skin. And also, you need to have in your cadre of friends the oral surgeon and the periodontist who support your practice, because when you run into trouble, you're going to have someone to speak to. And quite frankly, I do a lot of TMD therapy in my practice, and who do I get calls from? Oral surgeons. This is a TMD patient I can't handle. I need some help with it. So it's developing your cadre of support personnel, your friends in the game. And fortunately, you and I, we've had friends around the country because we've had an opportunity to lecture and being able to discuss difficulties in dentistry. It's not an easy profession. It's difficult business-wise. It's difficult scientifically. It's difficult technique-wise. And you have to have those people to help you out. That's where the whole thing of balancing the art, science, and business of dentistry came about. It's a three-legged stool. You can do the most beautiful dentistry based on lousy science and based on lousy business, and you're going to do terribly. And you can do great restorations that look ugly, but no one's coming back to you. And you can try to run your practice just as a business, and it's not going to work. You have to balance those three things.
Well, we'll talk about those three things: the art, the science, the business. How should she's been out of school 2 years working at Aspen. How does she learn art, science, and business? And then how does she learn to balance them?
So it goes back to what I said originally. Pick something that you want to be really good at.
But I got to stop you there because in 1900 there were 0 specialties, just physicians, and they were 1% of the GDP. By 2000 there were 58 specialties, and it was like 14.7% of GDP. Today you see so many people wanting to go back to 1900, where they want to master everything. They want to do all their root canals, fillings, crowns, veneers, cosmetics, sleep apnea, TMJ. Can you be a 1900 super dentist today and master everything?
I believe that you can go to a level of excellence. So an example of that, I don't do any ortho. I don't do any ortho. It has no interest to me. I dislike it. And whenever I attempted it, I realized, you know what? I'm not good at this. I'm not good at this. And Joe Stephen would say to me, are you kidding? You need to do ortho. Just like when people say, I'm going to learn how to do Botox. I have to tell you, with all the surgical things I do, I'm not interested in learning how to do Botox and end up with a droopy eye. But what I'm suggesting is that you can become a superstar in many different areas, but you have to pick a place to start. And once you master that, then go to the next one. And once you master that, go to the next one. I have to tell you, I became interested in TMD not because I wanted to be. I didn't want to become interested in TMD. Notice I said temporomandibular dysfunction, not TMJ. But my wife was suffering terribly. And I realized I've got to become knowledgeable about this. And so I started taking courses about it, trained with different people, and then realized, you know what, I've got this, and how it related to occlusion and how it started all interplaying. That understanding that you don't need any, you shouldn't have any balancing side contacts, and you need canine guidance, and you need anterior disclusion, and you need to have a centric relation and centric occlusion matching each other. But that was forced upon me. You can say, well, I'm not interested in that. Then find something you're interested in, get really good at it, and then they'll come to your door. They'll come to your door.
Okay, but I want you to walk her through it. She's never placed one.
I'm going to interrupt you. I don't want you to talk about implants. I want you to talk about something less sophisticated. I want to talk about feeling comfortable removing tooth number 19. I want you to become comfortable having profound anesthesia, understanding the chemistry of anesthesia, understanding patient management so they won't be frightened, understanding how to be confident, and remove number 19 correctly and painlessly. Get that down. And all of the difficult teeth. Wait a minute, I hate taking out teeth. I don't want to take out teeth. Then you know what? You don't have to worry about placing implants. I love doing root canals. I love doing root canals. Great. If you love doing root canals, hang your hat on a technique. I don't care whether it's crown down. I don't care whether it's Ruddle's technique. I don't care if it's Tulser. I don't care if it's Ultradent. I don't care whose technique you put your hat on. Hang your hat on one technique. Learn it so precisely that you could teach it and then move on. That's my point.
So you're basically saying, you can't start in the NFL. You got to learn the 4 basics. You got to learn a block, a tackle, a pass, and a catch. So you're saying get out of school and learn your basics, and hopefully in the basics somewhere you'll find a passion for one thing, and that'll be your first level of excellence. That's
exactly correct. You cannot eat an elephant all at once. You can eat it a bite at a time. And you have to be careful that you chew the elephant meat carefully so that you digest it carefully. But this is the bizarre thing to me, and it makes me crazy, makes me crazy. You walk down the aisle in a dental show, and how many bonding agents do you see there? 30? So if I turn around and I say to you, the number 1 bonding agent in the world by which all other bonding agents are compared is, then why do you need to look at any other bonding agents?
What is that bonding agent?
Well, wait a second. I want to basically say that if you decide you've chosen the XYZ bonding company, now I'm a Curare guy, and I lecture for Curare, so I have to disclose that. I lecture for Curare, and I use Curare materials, but I use other composites also, but I'm a Curare guy. I started learning, I was getting postoperative sensitivity that was bizarre, that was insane. And I suddenly realized, wait a second, I've got to find somebody to teach me how to do bonding with no postoperative sensitivity. Ray Bertolotti turned out to be my guy. You know Ray, okay? The guy that brought bonding to the United States, okay? I took his course. I go, wait a second. I get it now. I don't want to acid etch teeth directly. And so when you talk about total etch, which is around and people still do total etch, you say there's a better way to do it. So you have to follow the right guru. So now I don't have any postoperative sensitivity and haven't had for years. But you cannot, you have to be careful who you listen to, because if you make a mistake and you're not getting a good result, you need to look somewhere else.
I got some Ray Bertolotti trivia for you. See if you can
guess
this one. What does Ray Bertolotti's wife and my oldest sister have in common?
They both were going to be nuns.
No, my oldest sister still is a nun, but his wife used to be a nun in the same order as my sister.
So I got it half right.
Yeah. That how did you guess? How did you guess that?
Well, I didn't guess it. I mean, guessing is a fool's game. Knowing is that's an interesting thing. Guessing is a fool game. If you think you're guessing what you're supposed to be doing in your dental office, you're making a grave mistake. You need to know what you're doing. So I've had the opportunity. Ray Bertolotti contacted me and said, I want you to come and lecture in Yosemite about the H&H impression technique.
That was the first major impact you had on my life. But before you go to H&A, Curare, K-U-R-A-R-A-Y, but what is the brand of the bonding agent that you're using?
Protect Bond.
Protect Bond.
Protect Bond. So Protect Bond is an A-B system. You place your first agent on the tooth. You follow the directions. Unlike most dentists, you follow the directions. I scrub it on the tooth. You air dry it with clean, oil-free, water-free air. If you are using an oiled compressor in your office, you are contaminating all your restorations with oil. You need an oilless compressor, and if you have an air line that had an oil compressor on it, you need to change that line because it's contaminated with oil. So therefore, you need an oil-free line. You scrub your A on, you air dry it, you apply your B, you lightly blow it off carefully. You then light cure it the appropriate amount of time. Appropriate amount of time. You know, you need to, it's interesting, the millennials.
But that Protect Bond, that's clear fill Protect Bond.
Clear fill Protect Bond. But it's in a blue bottle. The older generation was in a yellow bottle. The new generation is in a blue bottle. But what's interesting, there is a whole other place in dentistry called biomimetic dentistry that's happening. Are you familiar with it, Howard? Biomimetic dentistry?
Yes.
Okay. So I've been doing biomimetic dentistry for 20 years. And someone say, how is that possible? Well, how it happened was there were a lot of indigent patients that were coming in from the former Soviet Union, and I was rebuilding teeth using fiber and not seeing a breakdown, using rib bond and not seeing a breakdown in these teeth. And then one day, someone said, have you heard about biomimetic dentistry? And I started being introduced to it by David Allman. And I'm going, wait a second, why didn't I publish this? I was afraid. I was afraid to publish it because it was out of the realm of regular dentistry. So you need to look into using fibers in your composites. You need to look into what biomimetic dentistry is and how to restore teeth. I am doing fewer crowns than ever before. I'll give you an example of that. So I'll tell you a quick story. The story is basically related to, I was afraid to publish it because it was out of the realm of quote-unquote mainstream dentistry. The amount of aggravation that I took about the H&H impression technique, not being able to work, it didn't work, you're ruining dentistry. I was afraid of being in a lightning rod. When David Allman, I heard him give a small talk about this, I'm going, wait a second, this is right. I know it's right because I've been doing it. Putting fibers in composites, having the rebar effect. Concrete works because of the support of the rebar. The rebar is actually floating inside the concrete. That's what it's doing. When the vector force goes down on the concrete, the force is absorbed by the rebar, it's distributed across the concrete doesn't break. When you put a composite down on a tooth, and you distribute the forces through the tooth, you're not jackhammering that tooth, and you don't get marginal breakdown. So for the millennials, they need to find out about biomimetic dentistry. They need to learn about that. Tim Rainey in his course, David Allman, his course, the Biomimetic Institute. There's so much to learn and so much to know. That's why dentistry is exciting. That's why it's exciting. So I'm doing fewer crowns. So the lecture I gave, a guy raised his hand and he said, I think this is a bunch of crap. Why do you think it's a bunch of crap? Because I make my money doing crowns. That's how I make my money. And I said, let's talk about dental practice for a second. How big an office do you have? Well, I have 3 operatories. Oh, okay. You have a full-time hygienist? No, I have a part-time hygienist. You have a front desk person? Yeah, I have a front desk person. How long have you been in practice? 35 years. Oh, great. Want to hear about my practice? It's 10 operatories. It's open 6 days a week. We're open 4 evenings a week. We have a staff of 25. Bigger isn't necessarily better. But when Mrs. Smith walks in and she's broken the cusp off of number 19 because she has an MOD amalgam in that tooth, and you say to her, Mrs. Smith, you need a crown on that tooth, and she says, how much is a crown? I don't know, Howard, how much is a crown where you guys are?
Well, everybody charges $1,000, but Delta pays $650.
Okay, so let's say $1,000, and she says, I can't afford $1,000. And you say to Mrs. Smith, I have an alternative technique for you that will last for years, will save lots of tooth structure. Ray Berlotti taught me the phrase, putting tooth structure in the tooth bank. Minimally invasive dentistry is where it's at. Mrs. Smith, I can restore your tooth in a biomimetic way, mimicking nature, so this tooth will last years for half the price of a crown. Is that something you're interested in? Yes, I'm interested in that. I can't tell you how much the insurance company is going to pay for this, but you will get a benefit. You will get some benefit. Now, I'm a lucky guy. I am a fee-for-service dentist. I don't have to participate in any insurance companies. And I will tell you, my daily goal production is $10,000. That's my daily goal. And if you don't have a daily goal written down, then you're not going to achieve it. Those people who write things down, they achieve them. So you have to write it down. Mrs. Smith now understands that I'm partnering with her in the restoration of her mouth to get it back correctly. And someone says, well, I make a lot more money doing crowns. I said, really, you do? Okay, how long does it take to biomedically restore a tooth? Let's say it's an hour. How long is that patient in your office for a crown? Let's say 2 hours. You're the MBA, Howard, okay? Let's say it's $1,000. You get back $600. You have a lab fee. I don't care where you get your crown done. Get it done for $60, $30, $100. Let's make it $100. That means you generated $250 an hour, okay? $250 an hour. If I turn around and I restore that tooth in an hour, start to finish, and I generate $500 with the cost of some composite and bonding agent and some Dentapreg. I use Dentapreg now, not Rib Bond, because I prefer it, but both work. And if you go to the Dentapreg website, dentapreg.com, Dentapreg, you'll see the techniques of how to use Dentapreg in a biomimetic way. And you'll see some of my cases. I'm generating $450 an hour instead of $500 an hour. Excuse me, instead of $250 an hour. Now, for me, I'm a fee-for-service guy, like I said, and so my fees can be a little bit higher. But when you're fighting, when you're in the wars of finding the balance between the art, science, and business of dentistry, would you rather have that patient stay in your office and have a procedure done, or would you have them leave because they can't afford it? And the answer is everyone can afford dentistry. Joe and I used to talk about some very interesting things about receivables and things like that. I'll go so bold as to say, Mrs. Smith, can you afford $500? And it's called hand-over-mouth technique. Because the first one that speaks loses. And so when she says to you, how can I pay for that? And someone would say, well, it's cash credit or care credit or this, that. I'm so bold to say, can you afford $200 this month and $200 next month and $200 the next month? Or can you afford $250 and $250? I'm willing to risk having the receivable in my book. Because my father used to say, when someone comes into the store, they need to leave with a sale. They need to leave with a pack of gum, a couple of apples, a can of sardines. They need to leave. It's with a sale. So when someone walks out of your office and they haven't given you any money, that's zero production.
So a segue to that would be, the guy says, well, I make my money on crowns. A lot of these millennials, they just opened up their office. They've been out of school 4 or 5 years, and they're wrestling with a chair-side milling machine.
You mean they bought it already?
No, they're wrestling with the decision because it's a major purchase.
It certainly is. and I have friends of mine who have CAD machines and they do beautiful dentistry, I could not make it work in my office. Now, I will say I was using the older technology, not the powder-free technology, but for me, if Mrs. Smith breaks off her front tooth or Mrs. Smith needs a crown, I cannot produce a quality product in my office that the laboratory can. I can't do it. But more importantly, now just because I can't do it, I am not the best dentist in the world. There are people who can do magnificent bondings. There are people that do gorgeous crown and bridge. I am much better than average, but there are always people better. But I will tell you, here's a trick to say to a millennial. There will always be people who can play better than you can. But Michael Jordan out-hustled everybody. It is amazing how lucky I get the harder I work. So I work hard. It doesn't come from the sky. So for me, CAD-CAM made no sense because I can prep a tooth quickly and efficiently. I can take a perfect impression every time with the H&H, and I can deliver a unit from a laboratory that's high quality that fits dead on. I'm not keeping my patients in the office for 2 hours or 2.5 hours, even though it's a single visit, because I don't want to tie up my chairs. I don't want to tie up my chairs doing that. So for me, it doesn't make any sense. Not only that, but no one is talking about the ROI on these machines, the return on investment. Well, let's see. If you have a CAD-CAM machine and you can produce a crown for $30, then you've cut your lab fee in what? In a third? In a half? In a quarter? I don't know the answer. But all I know is that I'm using a highest quality lab that produces gorgeous stuff. I'm paying them a reasonable fee for that work, and it fits every time. It fits every time. So I'm not a good lab technician.
Who's your lab?
I'm using actually 3 different labs. I use a lab in California called World Dental Lab in Irvine, and I'm using Utah Valley Dental, and I use Bonadent, and I use for my removables also a lab called Kaiser Dental Lab in Connecticut that makes the most gorgeous removables, partials you've ever seen. Not the cheapest, the most gorgeous. And if I have an extreme denture case that I'm doing, I use a gentleman named Aaron Deutsch in Phoenix. I think Aaron is in Phoenix, near you, or Scottsdale.
Yeah, he's been on the podcast.
Right. So Aaron is not one to toot his own horn, but Aaron won the International Denture Award that usually a European dentist technician wins. Aaron won that, and he and I gave a lecture in New York together. But again, when you talk about dentures, are you using a Gothic arch tracer? Do you understand about denture aesthetics and phonetics? Do you understand what teeth you should be using? Are you trying to do dentures for $500 a piece? You can't do it. You can't do it. You have to be willing to provide a higher quality care denture. So someone say, I'm handcuffed by the insurance companies. Well, you have to try to break out of those handcuffs because there are lots of people who want the highest quality care for the most number of people while maintaining a balance between their personal and professional lives. You have to be able to provide that. Now, here's the interesting thing. I was with Chris Kammer a number of years ago, and we were giving a lecture, and a guy came up to me and said, I want to do more porcelain veneers like you're doing, Dr. Hoos. I want to do more full mouth reconstructions. And I said, well, where do you practice? He said, well, I practice about 2.5 hours north of Madison, Wisconsin. I said, really? I said, what's it like up there? He said, oh, I'm the only dentist for 60 miles around. I said, what kind of dentistry do you do? He said, well, when someone's kicked by a horse, I have to do this. And when someone's doing that. And I said, I got to tell you something. If you want to sell cashmere sweaters, you might want to try to sell them at Saks Fifth Avenue in New York. And if you want to sell porcelain veneers, you might want to do them in a place where people are demanding that service. You don't want to open a big man shop in China. You talk about this all the time, Howard, is understanding who your audience is. And so therefore, if you want to do more porcelain veneers, you have to be somewhere where people want porcelain veneers and desire porcelain veneers. And I could say, well, Mr. Big Shot from the East, I have patients that fly in from Europe. I'm actually seeing a patient from Guyana tomorrow. Lucky me. But that's not everybody. You've got to service the clientele you're with. But if Mrs. Smith has a denture she can't wear and she is handcuffed by her insurance, you still have to provide the highest quality denture you can for her. And therefore, she'll tell her friends, I have my dentures in my mouth, not in the drawer.
I want to go back. You talk about knowing your audience. I know my audience. I always ask my homies to email me, howard@dentaltown.com. Tell me your name, where you're from, how old are you? I mean, it's amazing how many people are in D1 listening to you right now that never even touched a tooth yet. But at least 20-25% are still in dental school. The rest are under 30. They're doing their basics. They're trying to learn a filling, a crown, a root canal. With fillings, composites, a lot of times they're getting sensitivity. And you said you use Clear Fill Protect Bond. Which, and by the way, this is not a commercial. No one pays me to be on the show. I'm asking these. But they claim that Clearfield Protect Bond develops an antibacterial effect with respect to relevant causes of caries. The antibacterial effect of the MDPB monomer has been convincingly shown in single and comparison tests. Examinations by the Pulp Biology Group, University of Birmingham, show a clear reduction of cultivatable bacteria from MDPB in cavity preparations and teeth with natural caries. Do you think, so the question is this.
But that's not the key, Howard.
But the question, here's the succinct question. Jeff, I'm placing, sometimes I get sensitivity when I place a composite, a posterior composite. They never have that problem on anterior class 3s, 4s, 5s.
Howard, here's the answer. Guy calls me on the phone. He says, I'm having terrible postoperative sensitivity. I go, really? Let's go through the technique. Okay. I prep the tooth. Are you using copious amounts of water? Yes, I am. I prep the tooth. I then dry the tooth. I said, are you drying the tooth a lot, a little? Well, I make sure it's bone dry. So it means he's desiccating the tooth. Problem. Then he says, I'm putting acid on the tooth. I rinse the acid off. Then I put my Clear Fill Protect. I go, wait a second. Read the directions. Read the directions. You can't put acid on a tooth, rinse it off, and then put on the A liquid because you're not following the technique. Here's the key. Total etch technique absolutely works. But if you don't seal the dentinal tubules correctly, you're going to get hydrostatic pressure, C-fat, and if you bulk fill it, which is another whole thing, if you bulk fill it, what happens is you get C factors that are magnified and you get postoperative sensitivity. So you must follow the technique that's outlined in the directions. Of course, I can't get my VCR to work, so I don't listen to anything. But my point is, if you follow the technique and you use a good product, you will not have postoperative sensitivity. And you don't buy it off the gray market. You buy it from a reliable place, and you make sure it's stored properly. If you use a water-based bonding agent system, you don't have a problem. If you use an ethyl chloride-based bonding system and you put your bonding agents out and they evaporate, then you're using it incorrectly. You must follow the directions. That's why I'm saying, Howard, learn a technique, get it down perfectly, and then go on.
And one thing I learned in some hands-on classes getting my MAGD is they took you in the lab and they had extracted teeth and you did your bonding test and they knocked it off with the machine and we're all measuring it. And it was amazing how when I think there was like 10 of us back there, we're doing it, the bond strengths weren't what they advertised in the manual. And the teacher said, and you know what you all did? And he goes, none of you. It said apply, rub for 15 seconds. He goes, I was up here counting. The longest anyone went was 9. And I've noticed that some of the best dentists in the world, they have a timer sitting behind them on the counter. And
wait, I have a timer too. You know what it's called?
What?
My brain. Mississippi 1, Mississippi 2, Mississippi 3. How are you, Mrs. Smith? You doing okay? Mississippi 4. And then the other thing is I'm into watches. I wear a watch with a second hand on it, and I'll click the counter and I'll look at it or I'll glance over. You must do it appropriately in terms of the timing. You're absolutely right. But the problem is, I go into an office and I say, could I see your bonding light? And it's caked with a composite. It's caked with a composite because it's not getting it. You haven't got a true bonding light. Listen, you can buy a bonding light for $30 and you can buy a bonding light for $800. Buy a decent bonding light. Buy the Velo bonding light from Ultradent. It is a kick-ass light. Is it expensive? Yes. Is it worth it? Yes. How many of them do I have? I have 14 of them.
You know what I like most about the Velo? If you look down at it, a lot of people have curing lights that don't work. They're weak and they're falling apart, and they have to be measured. And one way you can measure it is, those little bands on your instruments, the color bands, the coating. You can take that band off, set it on your counter, squeeze in the composite, and then just cure, and then turn it over, see if it's cured through. But with the Velo light, you can just look down at it. If there's like 6 or 9 or whatever little sources. Yeah. If you look down and they're on, they work. It's there. And for it not to be working, one of those has to go out. So that's just clutch. That is
right. And my dental assistant has a bonding light also, and I will do side by side cures. But you have to follow the mechanics of how composites are done, meaning you have to do incremental buildups. For me, I have to do incremental buildups. I want to reduce the C factors. I want to make sure that my patient is comfortable preoperatively and postoperatively.
Well, you can't
technique.
Well, they want to know. You said you're using clear fill Protect Bond, so you got to tell us your composite, but you also have to explain your rant on bulk fill because you rolled your eyes back. So you got to explain where that eye movement came from. So what composite do you use?
Okay, so I use Curari composites, okay, and I also use some GC composites, but my go-to composite is Curari Majesty.
Curari Majesty.
And I always put a layer of flowable down before I place the rest of my restoration at the base of my boxes and on the occlusal aspect. I also use lots of Dentapreg in my composites. But for the D1 people, don't go there. But if you have a patient, it's a crazy thing. If you have a patient that's a very shallow composite and they come back and it's hurting them, it's because you didn't make the composite deep enough because you've got too many C factors. And the C factors are pulling the cusp tips in. So my go-to is Protect Bond, SC Protect, Blue Bottle, Flowable, Majesty Flowable, and then Majesty posterior or anterior, whatever I'm doing. Because these composites have a chameleon effect that's dramatic. Chameleon effect. You can be almost a shade off and get a perfect match.
And what's your thoughts on the bulk fills?
So my whole thing with bulk fill is this. If you take a carpule of anesthetic and you fill it full of composite, whatever brand you want to do, and you light cure it, and then you stick it into a vat of red dye, Watch what happens to the red dye and how it goes right up the walls of the composite and the carpule of anesthetic, because all composites shrink. Now, I have to tell you, there are lots of guys out there talking about bulk fills and they're getting great results. And I hesitate to speak negatively about anything. Okay? But for me and in my hands, it just doesn't make a lot of sense to me. I'm an incremental build-up guy. And if you go and take a biomimetic lecture, and they're all over the country now, or you're smart enough to go to the Biomimetic Society conference, you will see about and hear people talk about incremental buildups. That's just where I'm at. But you know what? Someone once said, if someone's doing it, then it's possible.
And then I got a couple more follow-up questions. When you said that Aaron won the competition.
Aaron won.
On the denture case?
Oh, Aaron won. Yes, right. I thought you were saying Aaron Deutsch.
Yeah, Aaron Deutsch. Just between me and you off the record, do you think he made it, or do you think his adorable, lovely wife made it?
He made it.
He made it? You think?
I think he made it. I don't know.
They say behind every successful lab tech, there's an amazing lab tech wife.
Well, all I can tell you is that I've known Aaron his whole life. His father has a lab in Stratford, Connecticut, and I saw him, and his father had a lab within my office in the basement, and quite frankly, Aaron's a very talented guy. So if his wife is lovely, and a shout out to Aaron, and I've sent Aaron some of the most difficult denture cases in the world, and he's come through. And but he's not $50.
I also want to give a shout out. You mentioned labs you use Bonadent. I think Bruce Bonifiglio, I mean, that is one of the most class act people on earth. And he's up there in where's he up there in New York? Is it Buffalo?
I think. Yeah.
Yeah.
And I have to tell you, I send him difficult attachment cases, and I send them very difficult cases, and they go, throw me another one.
So who's more handsome, Bruce Bonifiglio or you? That would
definitely
be
me. Definitely
you. Well,
yes.
Okay. he is just. I mean, and this guy is so successful. This big Walmart went out of business across the street from him. So guess what he did? He bought the land and building. That's how big this guy is. I mean, he is in the middle of Buffalo and buys out a closed down Walmart. I mean,
but you have to remember, Howard, he has a technician assigned to your case that is coming through from beginning to end, and it's like using a boutique dental laboratory. And what happens is they are doing the finest quality they can do. Just as World Lab, I got to tell you, it's a big lab. It's a big lab. They're doing high quality care. And I think that it's important for people to understand that you need to use labs that you communicate with. The rule, if they get a case from me and they can't read a margin or they don't understand what I'm doing, send it back. Send it back. Because what I say is I'm doing the easy part. I'm prepping the teeth. Everything what they're doing is making it so that it is a Mona Lisa. It's a Mona Lisa. I can't sit down and do a porcelain veneer.
Another thing I like about Bonadent is, the media always talks about the Fortune 500. Fortune 500. It's always the Fortune 500. They only employ 17% of America. America is built on family business. Bruce Bonifiglio's dad was a dentist. So he's his son and his sister. They're both laboratory owners. And now, last time I went down there, I was lecturing up the street from him, stopped by and said hi, and now his daughter's in there. And the world was built on the back of family businesses, and the Fortune 500 gets all the noise.
That's exactly right. And I have to tell you, I have 25 people that work for me that count on me to make their mortgage payments.
You know how many people work for me? About half.
and you're helping pay their mortgage,
Get it,
right?
get it. About
Oh,
half, only half of them work.
get it. You're too, yeah, you get it.
I
No,
love
I
that
have
joke. How
to
many people work for you? Oh, about half.
tell you, I will tell you that I have the greatest support staff in the world. I have people that my business manager, or I should say my office manager, has been with me for over 30 years. I have hygienists that have been with me for 30 years. If you treat them correctly, they will stay. They will stay. But you cannot squeeze every last dime of profit out of your practice and expect people to be happy.
You also, back when you were talking about Aaron, you were talking about dentures. You talked about two things. I need you to go back and clarify. They're wondering, what denture teeth do you use?
So there, I'm using Ivoclar teeth, okay, IPN teeth, teeth that are composite based, very strong. Also, and I'm having a brain abscess for a moment. I've forgotten the name of the anteriors. You can buy a card of anterior teeth for $12 on the internet, or you can buy a card of anterior teeth for much more money. You want to use the most beautiful teeth you can use that have the correct aesthetics. Don't cheap out on your teeth.
So it was Ivoclar. What was the brand name from Ivoclar?
Fornaris, I believe.
Fornaris?
Yeah, but I'm not 100% sure.
And then also you mentioned twice Gothic Art Tracer. So you got to go back and explain that to my homies.
So Howard, tell me what a Gothic Arch Tracer is. Well,
it was invented. I know it was invented by Batman in
So the question that happened to me in dental school, my denture instructor named Gallagher, I raised my hand and I said, I don't understand the difference between centric relation and centric occlusion when it comes to dentures. And he said, see me after class. And I said, Dr. Gallagher, I'm so confused. In restorative class, they talk about centric relation, and you guys, you don't even talk about centric relation. You don't even talk about, he goes, well, it's a different problem because dentures are not teeth. You cannot have anterior guidance in dentures. So I went on this quest, and quite frankly, Jerry Kaiser's father was the one that taught me about Gothic arch tracers. You have to look it up. When you do your bite registration, you are not using wax rims. You are using what's called an aesthetic control base. Your aesthetic control base gives you the position of your 6 anterior teeth. Then what happens is you use a device called the Gothic arch tracer. The plate fits on the top, the tracer fits on the bottom, and you find the vertical dimension the patient feels comfortable at. Now, it's an all-day course, Howard, but here's the deal. Somebody said, how do you find vertical dimension when doing dentures? And they go, well, I take an average, I have them lick their lips. Vertical dimension is a mechanical place, It is the distance between your chin and your nose. It is the distance between your chin and your nose. And what happens is that mechanical place is a place of comfort. What the Gothic arch tracer does is it allows you to get the border movements of your mandible and find where the CR is in your patient. You then take and lock that in. You transfer that to your dental laboratory, and they know exactly your vertical dimension. So it's more than this podcast can do. But I was giving a lecture, and Joe Massad, who you know, was sitting in the back of the room, and he said to me, how do you know the trick about vertical dimension? If you quickly take your finger and stick it in your ear, and you then take it and put it by the canter of your eye, and you hold it up carefully, and then you stick it underneath your chin and your nose, you have now found your vertical dimension. So Nabelman in Philadelphia measured 1,000 skulls and found out from the articular eminence to the canthor of the eye is equal to the average vertical dimension. And Joe Masad said, how did you find that out? And I said, I got to meet Nabelman many years ago. He taught it to me. He said, I got one's better. Hold up your hand. Put your pinky finger underneath your chin. Put your index finger by your nose. And there's your vertical dimension. So a guy calls me on the phone and after one of my courses and he says, that damn vertical dimension thing doesn't work. I thought, well, what did you do? Well, I went up to my patient. I put my finger underneath her chin. I put my index finger by her nose. That wasn't her vertical dimension. I said, you're right. You got to use her hand. It's her hand. It's an example of understanding the technique correctly. You know, I want to go back to something a little quickly. When I talked about profound anesthesia, if you cannot give a painless injection, then you need to learn how.
Word.
And I want to shout out to all of those guys, and I discussed it with you before. There is a new technique that's now available that is so exciting. Imagine being able to numb a patient's maxilla by having them put something in their nose. And it's not cocaine. And so I want to give you guys an opportunity to, I'm going to say, do something that's unprecedented. If you go out to the Covanace website, KOVANAZA.com, Covanace. This is a nasal, and this is an anesthetic that is put in the patient's nose and numbs from tooth number 4 to tooth number 12 profoundly without a shot. It's amazing stuff. So Covanace is giving me the permission to say, if you go out to the Covanace website and you go down to the sample section, you type in your email, you type in your contact information, and you pay for the shipping, which is like $50, they will send you $1,500 worth of Covanace to try.
Damn.
So
what do they do? They go to Covanace.com.
Covanace.com. They go down to in the website, they go down to sample, they put in their information, contact information, and Covanace will contact them. They pay for the shipping, which is like $50, and you will have a way to separate your practice from somebody else doing dentistry without injections. Now, you can't use it in the mandible. It doesn't work famously on posterior molars, though it does work. And it's technique sensitive. You have to learn how to use it. But this is a practice builder. And so I asked Becky, that she's the one responsible, I want to do something for your homies. I want to be able to do something. I don't know how much of it's available, but if you want to do it, you got to get on it. But I want to go back. If you can't give a painless injection to your patient without using topical, you have to learn how. So you know what I'm going to do is I'm going to give you a phone number, and it's going to make her crazy. 612-226-3706. And if you text her, she'll get back to you. So 612-226-3706. Becky Kipp, Kipp.
And now there is a contact us where you put in your name, your email, and your message. What could they put in the message?
Free samples.
Free sample.
Free samples from Howard Farran and Jeff Hoos' podcast.
Oh, don't get me involved. You just say Jeffrey Hoos. I don't want to get in trouble. I don't know. I don't know anything about this. I don't want them to get $1,500 worth and send me a bill. Where are those guys? Where are they located? What's area code 970?
Well, she is located in the Twin Cities. Oh, but Becky is located in Twin Cities. They're in Fort, the place in Denver.
Fort Collins?
Fort Collins, yes. Where everyone seems to go to have a dental office or a dental company. They're in Fort Collins.
Hey, you know how old I am? I remember in dental school, I was in dental school 83 to 87, and I believe it was my junior year, so I'd have been 86. I went to a dental office. You can't make this stuff up. I mean, this is how times have so changed. When he couldn't get someone profoundly numb on the anterior maxilla, he had an aerosol can of 99.99% cocaine. And he got into it because he had some oral cancer patients who couldn't swallow, and it was hurting their nutrition. And he said he would dispense that to the patients. They'd spray in the back of their throat, and then they could eat their meal. And he used to use that for a maxillary anesthesia, kind of like Covenase does right now.
Right.
And I swear to God, he used that stuff regularly. And then I remember I ran into him, I think it was like 6 or 7 years out of school or something. I ran into him again, and I said, do you still use that a lot? He goes, you know what? The asshole government, now I can't get it anymore. And I thought, because when I first saw it, I just thought, damn, I can't believe someone can get died. But did you ever see a can of aerosol cocaine in the day?
No, I've never seen that. But I will tell you that I do nasal palatine or stellate palatine pharyngeal block. I used to do pharyngeal desensitization using nasal swabs with lidocaine for TMD patients for mid-face pain. And, it works. There's no question it works. Covenase, listen, Covenase is technique sensitive. It's not for everybody. But the truth of the matter is, if you have an opportunity to try it like this for free versus spending $1,500, you got to go for it.
But why wouldn't you just use cocaine?
Because you don't want to get involved with that, Mr. Farran. Dr. Farran, I should say. And Your Honor, that's exactly the way it happened.
And you got to tell the story about the H&H technique. A lot of kids might not even know what H&H even stood for.
So the H&H technique was invented out of necessity. I used to do hypnosis in my practice. I treated a lot of dental phobics. Whenever I see a sign that says, or an ad that says, we cater to cowards, I'm going to call them and say, you can have all the cowards you want. Because it's very difficult to treat dental phobics. The key to treating a dental phobic is to treat them in such a way that they become a non-dental phobic. So what happened was a very, very dear friend of mine named Guntas Burzins, who's since passed away, who was a brilliant, brilliant lab technician, is part of the story. And so basically what happened was, I was trained to do rubber base impressions. Improgum wasn't even out yet, ether impression material. And the first guy I worked with used copper bands with compound, and he never missed an impression because he took the copper band and he drove it down and he captured the margin, and then he would pick it up with rubber base that smelled like, the worst guide stuff in the world. And I was using polyether impression material. And you cannot reline polyether impression materials, and you cannot reline rubber-based materials because of something called rebound. So one day, a patient came in, and she said, I am a terrible gagger. In fact, when I start talking about, I can't even talk about this, and I need to have a crown done. I said, well, how did you come to my office? She said, I saw my friend Sally from Scarsdale, and she told me that you were able to hypnotize her. And I'm going, oh, man, another hypnosis patient. It took 3 or 4 times to get them involved. And when you want to do hypnosis or desensitization, and they're afraid of a needle, what you basically do is you take the syringe, you put it close to their face, you tell them to think pleasant thoughts, and you put them in induction and all this kind of stuff. It takes a lot of time, and you don't get paid for it to do that. So I basically was able to get through the crown prep And I thought, you know what I'm going to do is I'm going to take a copper band impression of this and not use a big tray. And so I say to my dental assistant, Nora, can you give me a copper band? She goes, well, I threw those out. Well, why would you ever use, you never use copper band, threw them out. So what happened was I said to myself, you know what I'm going to do is I'm going to desensitize this patient. So I took some bite registration material in a gun and I said, let me just put a little bit on your top teeth and bite down on it. So she said, I can do that. It's okay, I can do that. And when I took out the impression, the bite registration, I saw that most of my crown prep margins were there. So I thought, maybe what I'll do is I'll reline this, see how good I can get it. Because when you take a copper band, you would add to the copper band to get a better impression. Or when you do a polycarbonate crown, you add to the margin and you keep pushing it down and pushing it down and pushing it down, and you pick up the margin. That's what you're doing, right? So I added a little material. She goes, yeah, I can do this. I can do this. I took it out and I'm looking and I go, wow, this is my impression. So I then wanted to make it a little more accurate and I added some less viscous material. Had it bite down on it. It's okay, I can do it. And I took it out. And then I proceeded to look at it and I go, well, this is never going to work because you can't use this. I don't have the opposite side. I don't have the anterior guidance. I don't have the full of the complement of the teeth. And I threw it in the trash. So I said to Mrs. Smith from Scarsdale, you're going to come back and we're going to do an induction using the hypnosis, right? Okay, great. This is terrific. So my dental assistant took it out of the trash. And she brought it to my lab technician because I had an in-house laboratory. And she says to the technician, I want you to make a crown on this. And the laboratory technician goes, no, I'm not doing that. Hoos will go nuts. I mean, he's panky trained. I mean, you know, there's no anterior guidance. There's no contralateral. How am I going to figure out the balancing side contacts? And she goes, shut up. Just make a crown on it as best you can. Lady comes back in 2 weeks. And I go, let's do our induction. And Nora goes, Dr. Hoos, why don't you try this crown back? Why don't you try this crown in? I go, Nora, what did you do? She goes, I'm just seeing if it will fit. I take the temporary off. The crown drops in, no adjustment. I go, this is kind of an interesting idea. And that afternoon, I did it again. And I did it again. And I did it again. But I wouldn't tell anybody because it was out of the mainstream. It's like everything else. It's out of the mainstream. Why use Dentapreg? Why every injection? You can't find topical in my office. Well, you can. I don't use topical in my office. Why? Because when you put topical in someone's mouth, the parasympathetic nervous system shuts off, the sympathetic nervous system turns on, they have an epinephrine dump, and they get nervous because you're going to give me a shot. That's science. That's why they get out of the chair to go to the bathroom, because they're afraid. So to go back, I did it over and over and again. I get a call from Guntas Berzins, may he rest in peace. I want to come in to visit your office. You are using more blue velvet than anyone in the country. What are you doing with it? I said, I take impressions with it. He goes, you can't take impressions with it. It's a bite registration material. I go, well, I reline it. You can't do that. It's a bite registration material. I said, well, come and watch me. So he comes up. He was from Latvia. He sounded like, you know, hello, this is Guntas. And he goes, this is unbelievable. I go, how many crowns have you done like this? I go, 500 or 600. He goes, how many adjustments? I go, none. He goes, it's impossible. I go, watch me do it. Then what happened was it started to be mainstream because more impressions are taken with triple trays than any other impression technique. Triple trays are inherently inaccurate because they flex. But what happens with blue velvet or blue mousse or a high durometer impression material, there's no flex. But more importantly, it's thixotropic. It sits on top of the tooth. It's totally inaccurate. That's why you have to reline it. That's why if you take a bite registration with an impression material, it's too fine. It won't fit together. Therefore, what happens is you have to recognize you need to use a thixotropic material of at least 90 durometer. So when Joe Stevens started using it, and he calls me on the phone and says, how do you do this? Because I can't get it to work. I go, okay, let's talk about your technique. And everyone was using it wrong. And so therefore, that's where H&H started. And now it's taught all over the world.
What's H&H stand for?
Hydraulic and hydrophobic. Use an impression material that hates water, pushes the water away. You want to hydraulically move the secondary impression material into place. Therefore, it moves the impression material into the void. Remember, two things can't operate in the same space at the same time. That's why you have to make sure you rinse out the crevicular fluid. You have to mix out the blood clot. You rinse out the blood clot that's there. And when you have the patient bite down, you make sure they're biting down into maximum intercuspation. So when you're doing this, it's technique sensitive. Also, don't try to do it with 15 crowns at the same time. Do it with one crown. Get your technique down.
And this is made with what material?
So you can easily use blue velvet.
And who makes blue velvet?
Blue velvet is made by by Jay Marita. jadamarita.com. And you can use a wash material. You can also use a GC product, but you have to use an 85 to 95 durometer-based impression material.
Is this still your go-to for a standard crown on a first molar?
Yeah, it's like non-thinking. It's non-thinking.
Well, these millennials, we put up 450 one-hour-long online CE courses, and they're coming up on 1 million views. When are you going to I wish you'd grace our site with a course from the man.
So I would be happy to do an H&H course.
Yeah. You know Howard Goldstein?
Sure, I know Howard Goldstein.
He lives in Bethlehem, Pennsylvania. I'm Howard at dentaltown.com. So he's the second Howard. So he's Hogo, Hogo for Howard Goldstein at dentaltown.com. But my gosh, I wish you'd make us a course on that, because that's a standard basic.
You betcha.
I think Glidewell says for Glidewell, like 94% of all the crowns that come in are single unit. So this is the lion's.
Triple trays.
Yeah. So that is an amazing technique. It was profoundly helpful for me early in my career, I still want to thank you for that. My God, we have gone over so far. Our brand's an hour, and we're already at 1:40. But I just want to tell you, man, love you to death. Totally respect you. You're one of my first mentors and idols when I got out of school in '87. Gosh darn, I've lectured. I've heard you lecture so many times. You're just an amazing man. Gosh, I hope you do that online CE course. And all these companies that you talked about, my gosh, I would love to podcast interview their CEOs, because I find it very interesting. The CEOs we've been podcasting have been having remarkable downloads. I mean, we just did the CEO of Strawman, different companies, and Dan Fisher of Ultradent, all these different CEOs. They love putting a face behind a name. So,
and listen, Howard, you and I, we go back a long way. Anything I can do to help. And I will also shout out to everyone. We are in the greatest profession in the world. We take people out of pain. We do things for them that they cannot do themselves. I want people to be proud of being dentists, feel good about being a dentist, because we're in a great profession. And when you're feeling bad, then find someone to help you so that you can feel good. And I've had many dentists come to my office and spend time with me in my office. I usually charge a bunch of money to do that, but maybe we could make arrangements for people to do that. Come to my courses. I'm happy to support anyone to have them feel good about being a dentist.
And where will they find your course schedule at?
I'm hiding it. Generally, they can go out to my website, dentalexplorations.com. But I'm basically, what I will tell you I'm doing now, Howard, is I'm lecturing less and less publicly, and I'm doing more courses at my office. We set up a little teaching area so we can have 25 dentists come to my office and learn. We're doing an implant course at my office that they can see live surgery. It's a 2-day course. Curari is talking about doing some courses hands-on at my office to learn.
And where's your office? Where is Stratford, Connecticut?
Stratford, Connecticut is between Bridgeport, Connecticut and New Haven. We're an hour and 10 minutes outside of New York. We're about an hour from Hartford going south. It's easy to get to.
Right on. But seriously, Jeffrey, thank you so much for all that you've done for dentistry. You're an amazing man. Thank you so much for coming on my show today and talking to my homies.
Hey, Howard, thanks so much for having me part of your life and you being part of my life. And I'll see you around campus.
And I hope they all get an online CE course. The millennials love that stuff. They love it. It's hour increments. You don't have to take notes. They watch it on their iPhone, or they throw it on their iPhone. They throw it up on their Apple TV, and they just tell me they would rather take an online CE course in their living room on their big screen so they can pause it, when their beer runs out. And then going old school to a bricks and mortar convention. And if you look at all this convention data, I think that's why
they're dying.
Yeah, they're dying and they're being replaced. I mean, when you look at almost 1 million downloads on Dental Town online, they just prefer to do it at home, an hour at a time, than sit there and wait till the Chicago midwinter. You know what I mean?
Right. But I also, that's why we decided to try to have people come to the office, because we can do it in smaller groups. It's not inexpensive, but they can learn a lot. And plus they have direct access to the guy telling the course versus being in a big room. I mean, I'm doing the Yankee Dental Meeting for the 7th year in a row this year. I'm doing a Spear Study Club, or a Seattle Study Club kind of thing. Look, you know the game.
But you know what you got to tell the Yankee people? I mean, you and I have spoken at Yankee in Chicago a lot of times. The millennials say, I love Boston, but not in February.
Yeah.
I mean, have it in May or November, October. The greatest regional meeting in the world is actually the Greater New York, because it's the weekend of Thanksgiving. And it's the most perfect weather.
Right.
It's not cold. It's not hot. You can walk for 10 hours and not even be exhausted. You go to Yankee or Chicago Midwinter, just from the cab to the Hilton front door, you're almost chattering your teeth. What the hell's wrong with them?
But do you know why the New York meeting was at that weekend?
Why?
Because years and years and years ago, the society, the 9th district or whatever it is, made a deal with either Macy's or Gimbel's or somebody to have the store open for dentists only, I think Thanksgiving morning or something. And what happened was they put that together, and the meeting used to be at the Hilton, and people would all stay in the Hilton, and it was like a real homey kind of thing. That's all changed. The truth of the matter is that the dental meetings are dying, and one of the presidents of one of the most major dental corporations said to me, if I could figure out and not be afraid to not go, I wouldn't go, because I don't make any money. I don't make any money.
Yeah, well, if you do the same thing year after year, year after year, and expect a different result, you're insane. I mean, I think they should try a better, warmer time of the year. I mean, if you're gonna have a meeting in February, have it in Phoenix,
Right.
not Orlando, not in
Have you
Boston.
spoken to Mike Abernathy at all lately?
In Texas?
Yeah. Have you
Yeah,
spoken to him?
yeah, yes.
Yeah. What's interesting is all of us in our 60s, like I'm 65, are trying to make a decision about the next 10 years, trying to make the decision of what's happening next. Nobody knows what's happening next. If you think you can predict in 10 minutes, then you're in the wrong business. But I do know, I mean, look, the longer the bear, the longer the bull, the longer the bull, the longer the bear. We are making so much money in the stock market, that's all going to come to an end. We know it's going to come to an end. We need to figure out how we're going to move this profession forward from being corporate-based to being a relationship-based business. I really should have talked more about that. The difference between making love, are we recording?
Yeah, yes, we are.
The difference between being with someone who loves you versus someone who doesn't love you, one is a transaction and one is a relationship. You want relationships with your patients, not transactions. You want to know about their children. You want to know about their families. You want to be able to treat them from cradle to grave. I've delivered too many dentures to funeral homes. Too many. I've been invited to more weddings and bar mitzvahs and christenings because I'm their family member. It takes effort to do that. It takes effort to have a relationship with your patient. You need to remember their kid went to Cornell or their son is sick and they need the best doctor. I have a list of physicians and doctors that I use that I give to my patients. You know the best orthopedist in town? That's who needs to be seen by your patient. I sit on the Smilo Cancer Board. If I have a patient that has cancer, they get into Yale, they get into Smilo. But it takes an effort to do that. You have to be willing to give part of yourself to your patient. Now, some people don't have the same personalities that can walk into a restaurant and have everybody be your friend like a Howard Farran. If you're shy and retiring, then you need someone on your staff to help do you that. But you need to be willing to give something of yourself to your patients. Not everyone's going to love you, but the patient does not care how much you know. They want to know one thing, and you know what it is, how much you care.
And these kids will learn that because it'll blow their mind their whole life where the patient will only have like one 3-unit bridge in their whole mouth. And they'll say, who did that 3-unit bridge? They have no idea. It's like you don't remember a person getting in your mouth and making a 3. They don't remember any of that stuff. And you'll also be confused, get rid of a lot of stress because you're going to have a lot of calls in your life where they call up and say, my God, that tooth you worked on last week, now it hurts like hell and it's keeping you up at night. And then your pit's in your stomach and you're all stressed.
Right.
And they come in and it's a totally different tooth.
Right.
Because they only remember you and how you made them feel. And you got to read How to Win Friends and Influence People. They only remember how you make them feel. They're not going to remember any of the transactional dental work.
Right, exactly. There were 4 books that really affected my life. How to Win Friends and Influence People. 7 Habits of Highly Effective People. In Search of Excellence. Chicken Soup for the Soul. Those books, though they sound trite, all have the same message. I'm going to tell you a quick story. I did a $35,000 full mouth recon for a lady 2 years ago. Called up on the phone. I bit down on something and broke off my 2 front teeth. Mrs. Smith, come in right now. I have a house full of people. I've got 4 hygienists working. There's a lot going on. That is an immediate emergency. She comes in and she snapped between 8 and 9. So 7 and 8 came off. Broke off, all porcelain unit bridge. I see the problem. The connection's not good. She says, Dr. Hoos, what am I going to do? I'm going away to Phoenix tomorrow. I said, it's not a problem, but you're going to have to hang with me because you're an emergency and I'll stay late and I'll take care of it. She walked out of there a happy camper. But Dr. Hughes, how much is this going to cost? It's my responsibility. I have replaced crowns that are 10 and 15 years old for no charge. No charge. That shouldn't have broken. That's just me. So I'll give you another example of building a relationship. A lady yesterday comes in. Her son's getting married in 6 weeks. I want my front teeth done. Well, Mrs. Jones, Mrs. Smith, you need 8 porcelain veneers to do this the way you want it. How much is that? Figure out. 8 times 1,000, 8 times 1,500. She goes, I can't possibly do that. Can I do it with cosmetic bonding? I said, you can. How much is it a tooth? $600 a tooth. I can afford that. But I'll take it one step further. These are not going to last as long as your porcelain veneers. If you decide in the future to have your porcelain veneers, I will subtract the $4,800 from your porcelain veneer case. Someone out there is going, what are you, nuts? The answer is, yes, I am. But I'll be happy to compare my gross and net with anyone in the country. Happy to do it. Happy to do it. Because it takes the burden off of me. I wasn't doing it for the patient. I'm doing it for me. I know that when she comes back in 2 years or a year with a chip broken number 8 or something, I can repair it. But she goes, you know what, I'm ready to do my porcelain veneers. So the fee in my office for a porcelain veneer is $1,650. Do the math real fast. I don't know, 10 times $1,650 is, $16,500. Subtract $3,300, so it's a $13,000 case. I am more than willing to subtract $4,800 from that case to do her porcelain veneers for her. And not only that, but I already know about the anterior guidance. I already know about the aesthetics. And so I can take a matrix of the aesthetics, do a suck down, or do a clear impression, prep those teeth for porcelain veneers, put my Pro-Tep in it from Danville, okay, with an A1, slap it down on there, and I can get that case done in half the time of my other case because I know she's happy with the aesthetics and the phonetics. So you know what? I've done hundreds of cases like that. Give you one more. Of course, a tooth comes in with a broken tooth. It's root canal. Needs a post and core and crown. Do not do post and cores on teeth unless absolutely necessary. They fracture teeth. Mrs. Jones, this tooth will fracture. I will subtract the cost of your crown when it comes time for you to do your implant on this tooth. Someone says, you're willing to do that? Absolutely, because I'm partnering with this patient. It is not a transaction. It is a relationship. It is a relationship. If you would look back to any failed relationship you've had with a man or a woman, think about how much you put into it versus how much they put into it. It is the yin and the yang. And sometimes you've got to put in 60 and they've got to put in 40. But if my wife hates Indian food, I don't say to her, oh, by the way, honey, guess what? We're going for Indian food tonight. It doesn't work. But if I'm with you, Howard, and I say, Howard, you want to go out for dinner? Do you happen to like Indian food? I love Indian food. Good, let's go. Because my wife won't eat it, and I'm with you. It's a relationship business, guys. It's a relationship business. And have I been burnt? You bet I've been burnt. Not everyone loves Jeffrey Hoos. But if you start out with one hygienist, and then you have 2 hygienists, and then 3 hygienists, and now we have 6 hygienists, we're retaining more patients than we're losing.
And what are your hours? You said you're 6 days a week, 4 evenings. What are your hours?
So we're open every Saturday. We're open 4 evenings a week. We start at 8:30 and we go to 8:30.
So you're 8:30 to 8:30, Monday through
Thursday.
Monday through Thursday. Then what's Friday and Saturday?
Friday is 8:30 to when the cows come home, and Saturday is like 8:30 to 3:30 or so. And I hope my partners are listening. We're going to be open on Sundays before you know it.
Yeah, okay. Well, hey, final note, we got to wrap this up, is that the grass ain't greener on the other side. The grass is greener where you water it. So build those relationships.
Hey, Howard, love you, baby.
Love you more.
Stay healthy. Stay healthy. I hope to see you soon, and we'll talk about doing that podcast for you. And people can send me emails, jchdmd@gmail.com. I will try to answer it. jchdmd@gmail.com. Learn to do painless.
You're Jeffrey Hoos. What's the C for? Charlie?
Yes, Craig.
Jeffrey Craig Hoos.
Right.
DMD. It'll help them remember the email if they have the name.
Right.
So Jeffrey Craig Hoos, which is JCH DMD, and gosh darn, that you're the other Craig. My other favorite Craig dentist is Craig Steichen in Albuquerque. Big shout out to Craig. But love you to death, Jeffrey. Thank you so much for coming on the show today.
I'll see you soon, Howard.
Okay, buddy, and make us an online CE course.